So we are all aware of this conduction system of the heart, which is the impulse begins at the SA node. When there is a dysfunction in this SA node transmission or transmission from anywhere else in the heart, like in the right atrium or in the bundle of His or in the AV node, there is the origin of this cardiomyopathies or conduction disorders. So one such case is where we term that as an arrhythmia, okay, where there is excessive contraction of the heart, whether it is atrial or the ventricle, we would call that as fibrillation or flutter. So please go through the basic terminology so that we can have a fair understanding of this procedural code. Now, in order to maintain these paces, right, when there is a disturbance in this origin of paces or in its conduction, surgeons have developed a device called as a pacemaker. Normally, there is a heartbeat. The heart beats like 72 beats per minute. Sometimes there may be a bradycardia where it might be reduced to as low as 60 beats per minute. In such cases, the doctor is going to install a device or employ a device within the human body called as a pacemaker.